Hello, my name is Kendal Sall, and this is my pathogen project. The pathogen that I researched was COVID-19, and the pathogen type is a virus. The causative agent is SARS-CoV-2, and the physical description is a enveloped positive single-stranded RNA virus. The virulence factors, there is a spike protein and is a structure that dictates movement, and it consists of two subunits, the S1 and the S2. The S1 binds to enzymes and controls where the enzyme breaks apart. And then the S2 facilitates fusion between viral and host cell membranes. The ORF3A is an accessory protein forming pores in the host cell membrane and localizes in the internal organelles. It increases viruses' ability to kill infected cells and activates inflammatory cytokines. Cytokines regulate inflammation, repair tissue damages that are caused due to infections. The route of transmission is person to person throughout inhalation of mucus and saliva, and it primarily spreads directly. There are no vectors involved in transmission. The signs and symptoms, so there's the common ones, which is fever, chills, coughing, sore throat, congestion, shortness of breath, muscle fatigue, headache, and the one that's most commonly associated with COVID-19 is the loss of taste and smell. The progression of, if left untreated, results in serious symptoms, so severe pneumonia, acute respiratory distress syndrome, also known as ARDS, multi-organ failure, and there's also a risk of neurological damage, so brain fog, cognitive issues, pulmonary fibrosis, which is permanent scarring of your lungs, irregular heartbeats, blood vessel damage, and also a risk of strokes. The types of treatments, so for severe cases, there is corticosteroids, they mimic cortisol, which is a hormone that is naturally produced in the body. There's immunomodulators, which modify the immune system, so they either boost a weak one or they calm an overreactive one. And then remdesivir, which blocks the replication of COVID through serious IV treatments. And then for more common cases, there's Paxlovid, which is mostly used in young kids, and it stops COVID from multiplying in the body. And then Lagevrio, which it stops copies in the body by tricking the virus into building errors into the genetic code of the virus. And then the specific medication that I chose to talk about was corticosteroids, and more specifically, it treats COVID by calming the body's immune system, and these drugs prevent dangerous swelling caused by the inflammation that COVID causes in your lungs. The precautions that need to be taken are, obviously there's vaccines, so there's an mRNA vaccine, and the biggest one is Pfizer-BioNTech. And there's also protein subunit vaccines like Novavax. The additional precautions that can be taken are open airflow, so just getting enough airflow into your lungs. Maintaining hygiene, so washing your hands, covering your coughs and sneezes with your elbow. For more severe cases, wearing masks and social distancing like we all did in 2020. And then also monitoring symptoms are essential. If anything concerning comes about, making sure that you note those symptoms and go to your local doctor's office. Some historical information. Pre-2000s, SARS-CoV-2 did not exist. It was created due to bats in late 2019. At the beginning of COVID in late 2019 and 2020, the incident rate spiked drastically, climbing to 4,485.2 individuals per 100,000 people in the total population. In places like the US, that metric reached as high as 21,065.69 per 100,000 people. Now, in the most recent years, 2024 to 2026, there's about a 94.2% of the population that has achieved immunity for COVID-19. That decline in numbers and that immunity that's struck is due to vaccines like Pfizer and Novavax and natural infections from just getting COVID-19. Those affected, the US, India, and Brazil were the most affected countries, as you can see on the map to the side. over on the left, there's the US in the dark blue, and then to the right, there's India and Brazil in the dark blue as well. US was due to high rates of underlying health issues and political polarization. Political polarization is a deep division in society in two opposing groups, and it was just really hard to make agreements on correct course of treatments. India was affected most due to the second wave due to the Delta surge, which was the Delta variant. It was more contagious than original strands, and due to the speed that it came about, there was little time for the public to prepare and adapt for it. Brazil was due to division between political figures, and that caused a delay in vaccines. The government ignored and rejected multiple early offers from major vaccines, including ones like Pfizer. And by the second surge, most people were unvaccinated and therefore unprotected from COVID-19. And then men were the most affected gender. Underlying medical conditions like hypertension, diabetes, obesity, and cardiovascular disease. And those were the same ones that were in the US for those underlying health conditions back on the past slide. And men usually just tried to push through, and it's scientifically proven that they tried to push through more. And them pushing through and then getting COVID, it led to severe immune overreactions. The case study I chose to do was one of the first citizens in the US to actually have COVID-19. It was a 35-year-old male. He was infected on a trip to Wuhan, China, and he was infected by close person-to-person contact. He returned home to Washington, and he self-reported a cough and fever. He went to the clinic, and the testing that was done were rapid tests for influenza A and B, parainfluenza, respiratory syncytial virus, rhinovirus, and andiovirus, and they were all negative. And due to his recent travels, he was then COVID tested, and the test was positive, and he was then hospitalized and quarantined. The first chest radiography was a few days into the hospital, and it revealed that there was pneumonia in his left lung. The patient was started supplemental air treatments due to that. And then a few days later, there was another radiograph that was conducted, and it showed a development of severe pneumonia. The treatment was remdesivir, and that was started then. A few days after, the patient's condition improved due to supplemental air treatment and remdesivir. He was asymptomatic aside from the intermittent dry cough and rhinorrhea. And then a few days after his asymptomatic, he was released home and quarantined himself until that dry cough went away. The interesting fact that I found is while bats gave COVID-19 to humans, humans actually gave COVID-19 to animals as well. In the US, the white-tailed deer population were the most affected. And with it being back in animals, the virus can grow and shift and hit humans as hard as it did for years to come. A few questions I have for you guys to leave in the discussion below is, do you believe that those that did not get the COVID-19 vaccines in the height of the pandemic were more susceptible to the illness, or if they got it, and then the immune system kind of built? And then also, due to COVID originating in China, should those who travel internationally be mandated to have a health screening done before returning to the country to prevent something like this happening again? I would really love your guys' intake on all of this, because I feel like these can have such a simple answer, but I also feel like they can really lead to some great discussion as well. And then here are my reference pages. And then thank you guys so much. Again, I'm Kendal Sall, and this was my Pathogen project.